Thank you for joining us here today.
Thank you.
Let's talk a little bit about some of the common infrastructure challenges while building healthcare facilities and how Schneider combats these challenges.
Yes. The challenge in healthcare facilities in particular goes back to the challenge of hospitals. How can they improve financial performance, patient safety, and patient satisfaction? Our point of view is that we can do that by bringing the right information to the right person at the right time. But to do that, all of the different infrastructure systems that are in the hospital need to talk to each other in an intelligent way. Today, when you go through this standard design and construction process, you end up with spaghetti because they go out for the lowest price that meets the spec. They end up with 50 different software systems, 5 different networks. And what we're saying is that Schneider Electric can help you design a hospital in a more intelligent way, the way that Boeing and Airbus build aircraft, and that bring all the different systems, even if Schneider doesn't make them, together in an efficient way that brings the right information to the right person at the right time. And that's what delivers financial performance, patient safety, and patient satisfaction.
Great, thank you. Let's touch on the current state of healthcare infrastructure in the Middle East and the UAE in particular, and if you see potential for growth moving forward.
It's huge growth in the Gulf area for healthcare. The leaders, depending on which country in the Gulf, each is competing to try to make their country a healthcare hub. As a result, they're making very significant investments in healthcare infrastructure. They're doing it for the local population also, but also for medical tourism. And so we're seeing, just in the UAE alone, 22 different hospitals and a huge population that are being constructed over the next years. Huge hospitals coming up in Qatar. We see Kuwait building. They hadn't done any hospital construction since before the first Gulf War, so like 1980s, and now making 8 mega hospitals that are currently in construction. So there's a big boom in this area in healthcare construction.
Let's talk a little bit about energy efficiency becoming an imperative for the healthcare industry. Is it going to become one?
It is one because a typical hospital room, patient room, or for a single patient, uses as much energy as 2 homes. Right? So hospitals are very energy intensive places. Now, typically in a hospital, energy isn't the first priority. It's patient safety and a number of other things, and you can't interfere with that. But hospitals are realizing that it's about 3% of their cost, 2 to 3% of their cost. And if a third of that can be saved, it goes directly to the bottom line. So that's one issue. We're seeing countries, especially oil-producing countries like in this region, Saudi in particular, but it's also an issue for the Gulf countries, is that as the populations are growing, but also using more and more energy, that they have less and less for export. And it's affecting government revenues and the overall GDP of the country. So in a sense, we say, oil is cheaper than water, who cares? It has a financial impact, and it's part of the bigger picture and why energy efficiency is important in hospitals. And the second reason also is green. To try to meet a LEED certification or some out of a green certification is a bit like a seal of approval that this is a world-class hospital, and many times hospitals are looking for that as well.
Well, it sounds like very exciting times ahead for Schneider,
it is, yes.
It's great.
Yeah.
Enjoy the rest of the event, and
Okay.
thank you so much for chatting to us today.
Thank you.